The cons of drawing are it's hard to master, laborious and time-consuming, and not very attention-drawing. The time required is usually, personally I find out, about 2 hours for a decent average image. If you want a sketch that looks pretty good, not necessarily artistic, but enough to convey your concept, it will take me around 2 hours to make it. And it's relatively hard to make. It does require some skill, and it will require quite a lot of training from you before you can create proficient images. Here, another example of a persistent truncus arteriosus, for example, another concept AI cannot understand. Here we have a ventricular septal defect, also an atrial septal defect, and a patent ductus arteriosus. Now I see these images from left to right shunts as a general rule, not just a specific one of them. And here one, for example, from level transposition of the great vessels. And this is what happens when I ask AI to create an image of tricuspid atresia. So you can see that overall it understands what a heart is, what the heart chambers are. You can see here, for example, right ventricle, left ventricle, right atrium, left atrium. It even got the aorta, right? Although I can see here like 5 pulmonary veins, doesn't seem quite right. But overall, the image is quite good. However, it doesn't understand what the characteristics of tricuspid atresia are, and that's pretty easy to deduce why, because there are not that many images of tricuspid atresia on the internet, so the image generation algorithm was not trained on it. That's why I generally use AI for my more artistic purposes on Instagram, and I tend to draw or paint when I'm trying to teach something, particularly a very specific topic.